Must be because you're runners. You got that endorphin high here. So welcome everybody. Thank you for joining us tonight for this runner's workshop. I'm Christine Hayes. I'm a physical therapist and a functional movement specialist. And I'm happy to say I'm joined here tonight with Dr. Alexis Tingan. And he is an avid runner, and he is from the University of Pennsylvania. And he is a sports medicine and non-operative guy. He's really a great connection for you guys to speak with any point during the evening. Also is Ken Taylor from the Running Place, and they're my go-to, one of my fabulous team that I send patients to for running sneakers and so on and so forth. So it's a pleasure to be gathered with all of you today. Shannon Bulger is an athletic trainer who works in our practice. She also used to work for Ken Taylor till I stole her from the Running Place one day when I was there getting sneakers. And he's forgiven me, so it's all good. And then Michelle Mallon is our patient care coordinator for upstairs and coordinates some of the services with the Integrated Healing Center, which we have on the second floor where you guys are. So I want to tell you how tonight will go. We're going to go till 7 or maybe a teeny bit after. And we're going to do this in 3 segments. So, first up is going to be Dr. Alexis Tingan, and he's going to speak about common running injuries from diagnosis to medical management. Then he'll turn it over to me, and I will be speaking tonight on what kinds of things do we look at from a running perspective that's specific to the things that you guys do. Stability issues, mobility issues throughout the body, and we'll also talk about orthotics. Do we use them? Do we not use them? How do we, really come to that place if we decide to do that? And also, we may be getting into some core exercises. A couple of you have asked for some core exercises. It's not something I usually do, and I'll tell you why. Because I'm giving out stretches, and that's pretty universal to what most of us need. But when it comes to specific exercises for your individual problem, we do so much more to comprehensively evaluate that first, just to make sure that what we give you to develop your core is done correctly, because so many times people don't know how to initiate from their deep core first before they do them. But since it was asked a couple times from some of you registering, I wanted to meet your needs, so I have a couple of those included in there too. And then finally, Ken is going to go over some of the latest and greatest in running apparel and sneakers and so on and so forth. At the very end of the evening, we will be doing a raffle for a complimentary massage for one of you here tonight, and then also, which is valued at $90. And then also we'll do a raffle for a Walker runner's kit from the Running Place, and that's valued at $65. So you'll get a couple of those treats, and Michelle will be here also as the evening wears on. If any of you want to take advantage of a complimentary running screen, it's in your packet. See Michelle; she'll get you scheduled. And if you feel like, hey, you know what, I need to go for a really comprehensive, more than the screen, 20-minute screen. I want to actually meet with a therapist and address some of these issues. She can schedule you as well. So the night's supposed to be very interactive, dynamic, fun, so feel free to express questions at any point in time. And I'll bring up Alexis now. Thanks, Alexis.
Sure.
To start us off.
All right, thanks, Chris. And as Chris mentioned, I'm one of the physicians, sports medicine at Penn Medicine, and I see patients out here in the main line, downtown as well. I see sports medicine, spine medicine, but particularly for me, I have an interest in running. As Chris mentioned, I'm a runner. I've been running for a while. I also take care of the Penn track team and medical director for the Penn Relay. So I see a lot of runners, deal with a lot of different aspects of running, not just the athlete, but also some of the logistics of the races and competitions we see. So before I start, I want to get a sense, and this is probably have Chris and Ken, the running experience that we have in the room. So how many people have been running for more than 20 years? All right, and how about 10 years? And how many people, this is 1 year of running? All right, so we have a pretty good range of people who've been doing it for a while, people who've kind of more recently picked it up. So I have a few notes, and the way I'll kind of frame what I want to talk about, I'm going to talk a little bit about the mechanics of running, and that kind of informs how we think about the different injury patterns that we see, and also kind of bleed into what Chris and Ken will discuss in terms of how do we rehab this, how do we deal with the shoes for the different injury patterns and different type of runners that we see. So the first question I'll ask, I'll actually leave it up to the group. Someone tell me, what is running? What's the definition of running?
Faster than walking.
Faster than walking. You know what? I get that answer, I think, every single time I give some sort of running talk. And so, and I always do this. Okay, so faster than walking. Okay, so this is maybe walking. Okay, that's walking. All right, and what's your name? I'm sorry?
Joanne.
Joanne. Okay, so Joanne's definition of running is fast walking. Okay. Is that running?
That's how I run.
Nope.
Yeah, you're race walking. Okay, we got to take this.
At least 1 foot has to be off the ground.
Exactly. That's the definition. I don't know what it is. Why? Like it's funny. I never thought about why everyone always says the first answer is always fast walking, and then the second person always gets it right. So yes, it's 1 foot off the ground in regular patterns during the gait cycle, and that's very important because that distinguishes it from walking, in which 1 foot is on the ground at all times throughout the gait cycle. And the reason why that's important is because of how we propel ourselves with walking versus running. So in biophysics, we call walking the inverted pendulum model, meaning that the way that we actually walk is really a controlled fall. So we come up, there's something called a center of gravity, which is where the center of our mass is. And a lot of our energy that is used with walking starts here, when we're at the highest point, when we're about to toe off. Because gravity is now saying come down, and we repel, and we come back up, and gravity says come down. So the energy that we use, the way we use energy with walking is actually using gravity to propel us forward. The opposite occurs whenever we run. So when we think in terms of physics, our energy, the highest potential energy is here when we're walking. When we're running, actually it's lower here. And the reason why is because we get a lot of our potential energy when we run from when we're loading the muscles in our legs. And we use the muscles in our legs to load with energy and then propel off. So that means that we need, as we take each stride, we need efficient energy transfer from coming up and then going down with lots of potential energy, coming up and landing down with a lot of potential energy. So that plays into how we efficiently run faster, but also how we prevent injury. So that being said, there's a thought that if we look at the animal kingdom, there's really no other animal besides maybe the dog and the horse that can run longer than humans. And you think about all the other animals that can run a lot faster than humans. So evolutionary biologists say that we're actually adapted and designed to run distance and not necessarily sprint. And if you think about it in the savannah, and you're in a hot, open savannah, if we can outlast our prey, then they eventually run out of energy, and then we actually go and capture them. And I think that's an interesting, I think the reason that's an interesting thought is because a lot of times we think about running fast, but actually it's really distance running. We're actually made to be distance runners. Now, if you look at just our biology, the way we're made, there's certain adaptations we have, and I think the most interesting one is something called the nuchal ligament. It's a ligament in the neck, and it's pretty much not found in any other animal. And the interesting thing about this ligament is that it helps to stabilize our head. So usually when you're running, the head wants to bobble, but we're actually able to keep it straight. And the reason why that's important, obviously, in the savannah or for hunting prey, keeping our head straight is allowing us to scan whatever we need to scan and find our prey and stay out of danger. So, so when I think about a runner comes to my office, and someone says, like, "Oh, I'm not a runner," or whatever. I say, "No, we are a runner." What's happened is that like our Western society, where we sit down every day and we like eat all this different kind of food, has morphed us into not optimized runners. But we're all runners, and that's kind of who we are, and that's the philosophy I preach a lot to my patients. So back a little bit to the physics here, and then that'll tie in as we begin to talk about injury pattern. there's this whole idea of what is the optimal way to strike the ground. So, almost everything, the way I look at it when we're running, kind of starts at the foot because that's what hits the ground and that's what propels us forward. And so it's always important, and I'll talk about my analysis a little bit more in a second, but the foot is very important when we're thinking about running. With running, there's 3 different foot strike patterns. There's heel strike, striking the ground first with the heel. There's midfoot, where kind of the midfoot area strikes the ground first. And there's forefoot, where the forefoot strikes the ground. And if you ever go and observe people run, just casually, you'll notice these different foot strike patterns. Now, obviously, whenever we're sprinting, we see more people that will forefoot strike. But the question is, and it has been for a while, which one of these foot strike patterns is better? And which one is more efficient? Which one prevents injury? And my opinion is that it's actually the forefoot striking pattern that's the most efficient for most people. However, my general philosophy is that if you have a certain foot strike pattern and you have no issues with it, just go ahead and continue on with that. But the reason why this is important is because a lot of times I get people ask, like, what about the barefoot running? What about the minimalist shoes? What about that? And so the thought is that when you barefoot run, you may preferentially forefoot strike, more so than midfoot strike, more so than hind-foot strike. And the whole minimalist shoes, and which Tim may talk about a little bit later, are meant to kind of mimic the barefoot type walker. Now, I'm going to demonstrate something in a second to you guys about why the thought is that forefoot striking is more efficient than hindfoot striking. And it has to do with this idea of transfer of energy, which we were talking about before. So we said that when you come up from running and then you're down low, you're loading the muscles and you're propelling forward. So there's something called impact transient. That means when you hit the ground, all of a sudden energy from the energy you place towards the ground comes towards you. Now, that energy can either just go through your joints and your muscles, or just go through your joints, or it could be loaded into your muscle. So I want everyone to stand up, and I'm going to demonstrate what I'm talking about, and then we'll talk a little more. So, what I want everyone to do is jump up and land on your heels. So jump up and land on your heels. Right. Yeah. So you hear that sound. Now I want everyone to jump up and land on your toes. Right. So you may have heard, and go ahead and have a seat. So you may have heard the difference there. And the difference is when you land on your heels, it's just a boom, a sudden impact. When you land on your toes, it's kind of softer. And what's happening is that when you land on your toes, your calf muscles, your hamstrings, and your Achilles tendon are softening the blow, but they're also loading with energy. And when you're running, that's advantageous because that energy is then transferred to you running forward. The thought is that when you forefoot strike, you hit the ground, you lose all that energy, and your ankle has to roll over and create new energy again to propel you forward. So, I use that kind of as an aside because a lot of people like to ask me, like, is it forefoot strike, is it hindfoot strike, is it midfoot striking, which one's the best? And I usually say forefoot striking, but as I said, if you're doing something and you're having success with it, I usually don't play around with it. But what is it about? Well, I'll leave that out for now. I'll talk about go back to barefoot if you guys want me to. But the question is, which one of these foot strike patterns can prevent injury? And the important thing to think about is that depending on how you foot strike, you may develop a different injury pattern. And so when people hindfoot strike, the injury patterns that you typically see are your patellofemoral syndrome, which we'll talk more about, IT band problems, and hip problems you see very often, and shin splints as well. When you forefoot strike, we see a lot of Achilles tendon and calf type problems. So if anyone's saying like, oh, should I change like how I run or like my foot strike pattern, really you should consider if you're having injuries and what your injury pattern is. All right, so let's move on to injuries and how I evaluate them. And when we get into injuries, I'm going to kind of leave it a little interactive. I'm not going to go through like every single one, everything I do. I'm actually going to kind of take some questions from you and kind of see what you want to know about the different injury patterns. But let's talk about evaluation. So there's when I have a runner in my office, there's 4 different kind of stages that I consider them in terms of evaluating. So one is a standing walking evaluation, watching their gait. The next one is a standing. The next one is laying flat, and then the 4th one is running. If we actually do a running analysis with an athlete. So in my walking evaluation, I'm just looking just how you walk. So you have one hip that's dropping. You have are you leaning to one side? Is your foot clearing as you swing the foot through? Very simple evaluation. When I do my standing evaluation, really one of the things I like to do in the office, and you can even test yourself and see how good you're at this, is a single leg squat. And this test, I like this test because it actually tests a lot of different things. It tests your core stability, it tests your hip stability, your hip strength, and also tests the control at your knee. So the thought is, and most people are not good at this, and I've had to work really hard. But as you squat down, and what I'm looking for is the leg going in, is the hip dropping to one side, is the hip dropping to another side, because if you have a weak core, a weak hip, you may see these things happen. The most common injury that I see is patellofemoral syndrome, and that's basically when the kneecap, as you flex and extend the knee, and as it interacts with the femur, it's not tracking correctly. And one of the reasons why we can develop it is when the knee kind of goes in, every time we take a step, if the kneecap kind of tracks in correctly, over time that overuse can create problems and can create pain. So when I'm looking at you in the office, I'll have you extend out the leg, and I'll have you squat down. And if I see the knee go in, I know that we found kind of our problem. The problem is the knee is tracking out. Now, how do we correct that, or what's the problem? The problem very often is this gluteus medius muscle, and that's the muscle that prevents us from going down like that. It actually keeps our pelvis upright. So I'm really taking a look at that hip and that core when you're doing that. Now, there's other ways to do it. Sometimes patients know that I'm about to do that, and so they've practiced when they come to the office. So I have them go out like this, I have them go out like that, and I have them like do all different kind of things. But really what I'm trying to do is assess the core and assess that hip muscle. The gluteus medius, this is my opinion, the gluteus medius is probably the most important muscle for runners, and one that I feel is very neglected. And the reason is because we spend our lives, we get in the car, we sit here, and we go to the office, we get up and walk in a straight line, we go to the office, sit down, and then we get up, go back to our car, sit down, eat dinner, sit down, and then we say, okay, let's exercise, and we do exercise, we go in a straight line. So if you think about when we're kids, what did we do? We went to recess, we played basketball, we played football, we did a lot of unpredictable movements, a lot of lateral movements. And that lateral movement, unpredictable movement, really works your hip muscle, your gluteus medius, and your core. And so we lose a lot of that whenever we, in our modern adult and Western lives. So the sitting evaluation, a lot of times what I'm doing, I'm just looking at the core. So I'll look at a patient and see, are they able to do a bridge? Are they able to do a plank? I see elite runners that really have difficulty doing even the most basic plank type exercises. The running evaluation is a little more advanced, and those are people who either are high level type runners or just really have had nagging injuries and they're just not getting better. And I have therapists downtown in one of my offices, and we'll put them on a treadmill and we'll watch the running, and we'll look at everything from the foot mechanics, how the foot strikes the ground. So we look at forefoot, hindfoot, midfoot striking. Is there pronation or supination? That's if the toes, ankles going in or out. We'll look to see how stable the knee is, and look at the hips as well. So it's a little bit more advanced analysis, but you don't really need that. I would say 95% of people I see in the office don't even need something like that. So just use a few minutes to kind of talk about injuries. So I talked about patellofemoral syndrome. I talked about, I mentioned a little bit hip problem, IT band, calf problems, Achilles tendon problem, but talk forever about that. I just kind of want to know from you guys, like, what injuries are you kind of curious about? What do you have? Maybe what is people you've known? What do they have? Just kind of what do you want to know about these injuries?
Is it fair to say that when you're slower you're running, kind of more vertical you are, and the more you're heel striking, and therefore, and as I've aged, obviously I don't run as fast as I used to.
Right. Yeah, that's a great.
But is there a way to avoid that when you can't run a 7-minute mile anymore?
Right. So your question specifically is a way to avoid heel striking, or a way to avoid like the injury, like to the hip or something.
Well, I think it's the heel striking that is,
right,
hurts my hips and knees.
Right. So, so that's the first one. That's a great point. The interesting thing is that when we run faster, we actually tend to run more efficiently. That's why when we sprint, you never see someone sprinting like this, right? So we sprint like on our toes because, as we established, that's a very efficient transfer of energy. So every time you hit the ground, you're not getting that what we said impact peak, impact transient going up. You're actually using that energy to load the muscles and propel forward. So there's kind of two ways to go about it. One is like actually just formal gait retraining. So you go see a good therapist, you see someone like Chris, and you can actually retrain how you strike the ground. Literally, like you just practice it instead of heel striking every time you. Or if you are a heel striker, you actually just practice, just running on when you landing on your toes and pushing off on your toes in your gait cycle. The other thing is also just running faster. As we established, like sprinting, obviously we're the most efficient when we sprint, but also running shorter distances, we're running them faster. And that's a way to kind of remind your body to have that proper, not proper, but to do that forefoot striking versus the heel foot striking. So, so I would say just changing the way you run, and then in addition to changing the way you run, shorten the distance but increase your speed. That kind of answer your question. Look.
Well, when you say shorter distance, you mean this length, stride length?
Well, not just stride length, but the
distance.
amount of distance that you're doing. Because if you're increasing your pace, you're going to increase your running efficiency. Now, I mean, there's a lot more details within that in terms of like cadence, stride length, how much flexion you need, all these different things, which we can talk about more later. But the general principle would be just literally change how you're striking the ground, and then decrease your distance and increase your pace to run more efficiently, and you preferentially run on your forefoot. The other thing, obviously, I alluded to it before. If you run actually barefoot, the studies have shown if you run barefoot, you actually will preferentially forefoot strike more so than hindfoot strike. But not everyone can, sidewalks of Philly, aren't necessarily conducive to running barefoot. But if, on a track, on a nice soft ground, grass, you can run barefoot, and actually you will find yourself doing more forefoot striking than hindfoot striking.